We are back with another exciting episode of Let's Talk. What we do on the talk is that we pick a medical condition, we break it down to the layman's understanding so that you get to appreciate whatever is happening to you medically. In today's talk, we are going to talk about urinary tract infections. Yes, UTIs. When we say UTIs, it's just an infection or an inflammation to the urinary tract system or the urinary system. The urinary system, as discussed in my previous episode, consists of the kidneys, the ureters, the bladder, and then the urethra. In today's episode, we are going to discuss about diseases or infections that affect the various organs I made mention of. We got to know that UTIs are more common in females than in males. We also get to know what are some of the causes of UTIs. We also get to know what are some of the treatments of UTIs, some behaviors that can make a person stand a risk of getting urinary tract infection, and some of the things that we can do to prevent us from contracting UTIs. So please, kindly stay tuned, subscribe for me if you haven't subscribed to this channel, give it a thumbs up if you like it, and also please share. Urinary tract infection is just simply an infection to the urinary tract or to the urinary system. And in my previous episode, we talked about the urinary system, of which we made mention that it consists of the kidneys, the bladder, the urethra, and then ureters. Precisely, UTI mostly affects the urethra, the bladder, and then the kidneys. Infection to the bladder is called cystitis, and infection to the urethra is called urethritis. Infection to the kidney tubules or to the kidney is called pyelonephritis. Most of the time, the organ that mostly gets infected is the bladder. Urinary tract infection is mainly caused by bacteria and microorganisms. UTIs are more common in females than in males because of the shortness of their urethra and also the proximity of the urethral orifice to the anus. Also, anatomically, most females don't know that they have an opening where their urine passes, and also another opening for sexual intercourse. So I advise that every man should take a mirror, look down, and you see a small opening beneath the clitoris. That's where urine passes, and then the larger opening for sexual intercourse, and another opening where feces also passes. Due to this simple anatomical difference or anatomical positions, it makes women stand a risk of getting urinary tract infections. Also, due to the shortness of the urethra in females, any slightest opportunity that microorganism gets, there's a set up and cause a infection to either the bladder or the kidneys. That's why sometimes most women will go to will visit the private toilet or a public toilet, and they'll just come and say, "Doctor, me call toilet, me call a mansan toilet so, me call so no, I call kunya yare." Sometimes most women try to confuse UTIs with STIs. STIs is mainly contracted through sexual intercourse. Inti oko toilet so a microorganisms nam from mama ebi enya kwan ko ase ema wa gbe wa se hyew wo ne be ma da ne ye wo ya wo hwa no wa ya se ye wo ya bantin eye wo se wonye STI but nye STI mu ma UTI. Inti so binya UTI ana so nya urinary tract infection ade bako social no say oh ha say just do on tentem just do on say wan kan ho no do on so abo oda ho na jo a woni timete ne ju oda na jo tim na odun so tentem sebi so no be ma da no wase hyew wo hwa no hu se won fe no won fe eko wachi wo eye wo ya wo hwa no fufu no wo hwa na wo fe sane mo nim nyina no e kire se nipa no anya urinary tract infections. Please don't feel shy to tell a doctor that you are seeing some discharges from your private parts, you are seeing this on you are seeing that on you. And please debunk that perception. Say when you start experiencing that because when these microorganisms are sent up and then they hit your kidneys, they are going to cause other infections or they are going to cause problems to your kidneys. And mind you, you're going to know from my previous episode that the kidney play a very important role in the body functions. So please protect your kidneys, protect yourself so that you don't contract such diseases. I know, but now you are wondering, how do I prevent the risk of getting UTI? Don't worry, I got you covered. Please try to always practice the following. Always try to drink plenty water. Drinking plenty water dilutes the urine and also makes you urinate or flush out the microorganisms easily. You should always try to wipe from front to back after urinating and also after bowel movement. By doing this, you prevent the spread of bacteria from the anus and also from the vagina. Always try to void right after sexual intercourse. We also advise that most females should stop using feminine wash. So in today's talk, we got to know that urinary tract infection is simply an infection to the urinary tract system or the urinary system, mainly the urethra, the bladder, and then the kidneys. We also got to know that the organ that mostly gets infected the most is the bladder. Also, we got to know that some behavioral practices or some activities such as holding urine for a longer period of time, not drinking plenty water, using douches or using irritative products predisposes one to getting urinary tract infection. This brings us to the end of the Let's Talk on UTIs. Thank you, and please subscribe. Don't forget to share for others to also see or get to know of this important information. See ya!